families joining us. My name is Ellie, and my colleague Marle will be doing the presentation today. We would like to welcome you all to the Changes Addiction Rehab's Family Support Group. This weekly meeting takes place via Zoom on Tuesdays from 6 p.m. to 7 p.m. South African time. We observe confidentiality at this meeting. We ask that who you see here, what you hear here, when you leave here, let it stay here. We ask that you focus on yourself and on your recovery and not on discussing your addicted or recovering loved one. You may be filled with fear and anxiety and have many questions to ask. This platform is to help you learn healthier ways of dealing with addiction, its effective treatment and recovery. Please do not ask questions relating to your loved one in treatment with us. Those questions can be answered by their counsellor. As addiction is a lengthy process, so too is recovery. We are unable to offer a quick fix or a miraculous solution. It's best that you commit to your own recovery process and learn about boundaries and bottom lines. We ask that you take responsibility for yourself and your own actions to facilitate change. We ask that you learn how to empower your loved one's recovery and learn how not to enable their disease. We hope that you will see value in your own healing. Each meeting, the host will do a presentation and you're welcome to present with or without your video on. We will allow space for questions before we close. Please raise your hand if you want to speak. We will limit this to 2 minutes per person, 12 hours. Kindly do not speak on this meeting platform. We believe it might be the chemicals talking and not you. Over to you, Marle.
Thank you, Ellie. Hello, everyone. As Ellie mentioned, I am Marle, and thank you for joining us tonight. We are here to discuss a topic that affects many families, and that is addiction. When a loved one struggles with addiction, it impacts the entire family. It's so easy to focus all our attention on helping them, but we must not forget the importance of taking care of our own selves. So tonight we will explore why self-care is crucial for families affected by addiction and how it can help us maintain our own well-being during these challenging times. In tonight's PowerPoint, we are going to focus on what self-care is by looking at the different types. So we're going to look at physical, mental, emotional, spiritual, and intellectual self-care. We're also going to discuss tips and recommendations and give examples of how self-care can look like. And then we're also going to discuss the neurotransmitters in our brain and how we can do activities to release these hormones. And then lastly, as Ellie said, you will be given the opportunity to ask questions. Okay, so self-care is vital for everyone, but it becomes especially important when dealing with the stress of a loved one's addiction, as I mentioned. Proper self-care allows us to maintain our physical and mental health, providing the strength and resilience needed to support our loved ones. Without self-care, we risk burnout, chronic stress, and a decline in our overall well-being, which can make it even harder to be there for our loved ones in a meaningful way. So self-care is defined as the practice of taking action to preserve or improve our own health, or the ability of individuals, families, and communities to promote, maintain health, prevent disease, and cope with illnesses as stated by the World Health Organization. So when it comes to self-care and neglecting our self-care, it can lead to serious consequences. And these may include physical health issues, so increased risk of illness, fatigue, and a weakened immune system. It can cause mental health problems, so higher level of stress, anxiety, and depression. And then also emotional burnout, so feeling overwhelmed and irritable and unable to cope with daily challenges. And lastly, it also put a strain on our relationship. So it increases conflict and reduces the ability to provide effective support. So to prevent these outcomes from happening, it is essential to incorporate self-care in our daily routines. So self-care isn't just one thing. It encompasses several areas of our lives, like I mentioned. So for tonight, let's explore the different types of self-care, and I will give you examples of how you can practice each of them. So firstly, it is physical self-care. So physical self-care involves taking care of our bodies to maintain health and energy. So examples of physical self-care would be to get your body moving. So to exercise, promote the production of feel-good chemicals in the brain, which makes us feel content. It also reduces the likelihood of illness and certain diseases. You do not have to be a Zumba master or a bodybuilder to work on your physical self-care. You just need to start moving. Regular self-care activities include things like walking, yoga, or doing sports. With physical self-care, it also includes your nutrition. So food is your medicine. It fuels us by giving our bodies the nutrition we need to operate at maximum capacity. One of the best ways to practice physical self-care is to eat right. So eating a balanced diet rich in fruits, vegetables, and whole grains can help with a better nutrition. And then lastly, under physical self-care, it includes a healthy sleep pattern. So I am aware that all of us are incredibly busy, and being in this position, we're not only focusing on our own lives, but we're also stressing and focusing on our loved ones. So having a healthy sleep pattern is not always feasible. However, getting a full 8 to 10 hours of rest every night is critical to our physical health. Ellie, do you have anything you would like to include here?
Not at the moment. Thank you, Marle.
Okay, so let's move on to emotional self-care. So emotional self-care is acknowledging and nurturing our feelings. So you feel them rather than running away from them. And this is not something that only our loved ones in rehab struggle with, but many people struggle to be confident in their emotions, to feel their emotions. Most of us would rather run away from them or suppress them, right? So a way that you can improve your emotional self-care is to talk to someone that you really trust, and to develop healthy coping skills to manage your emotions more effectively. So examples of this is journaling. So having a little book where you can write all your thoughts down and your experiences. Another way to improve your emotional self-care is to go to therapy or your own counseling. So speaking with a counselor and therapist about your feelings and the emotions that come up, they can also help you with developing more healthy coping skills to deal with those emotions. And then lastly, a recommendation or an example for improving your emotional self-care is mindfulness. So this includes practicing meditation or other relaxation techniques. By mentioning or recommending these different examples, I think it's just important to note that this is just a few examples, and what works for me might not work for you. So it is important that you go through a trial and error. Some people, if they feel stressed, they go for a run. and they feel better, they release their anxiety. But other people like journaling about it, just to mention that before we go on. Okay, so then another type of self-care we get is mental self-care. So mental self-care focus on managing our mental health and the emotional well-being. It involves practices that helps us cope with stress, process our emotions, and maintain a balanced state of mind. So mental self-care is about how you think, how you process information, and how you make decisions. So key activities to improve your mental self-care is taking mental breaks. So for example, taking a short break during work or study to rest and rejuvenate the mind. By taking regular mental breaks, it can prevent burnout and keep the mind fresh. Another way to improve your mental health is stress management techniques. So, for example, techniques like deep breathing exercises, so breathing in and out, process muscle relaxation, or guided imagery. Sorry, we can see it's the end of the night, and I do think we all need the holiday tomorrow. Okay, Ellie, do you have something you would like to add before I continue?
Yeah, I think with the mental self-care as well as the physical and emotional self-care, I think we need to understand that it's not just about sitting in a lotus position, but it's actually about working through the connection between these three elements, because ultimately they affect each other. The way we think affects our body, our bodies, our behaviors affect our emotions. So all of these are interlinked.
Thank you. Thank you for adding that. Okay, so the next type we get is intellectual self-care. So intellectual self-care is about engaging our minds in a way that stimulates and challenge our thinking. So this involves activities that expand our knowledge and keep our cognitive functions sharp. Okay, so key activities for improving your intellectual self-care is maybe learning a new skill. So for example, taking up a new hobby, learning a new language, or enrolling in a course that you find interesting. So by continuing your learning, it keeps the mind active and it improves your cognitive abilities. Another example of intellectual self-care is reading. So, for example, reading a book or articles or journals on different subjects. By doing that and reading, not only enhance your knowledge, but also improves that concentration and keep focus. Okay. Another example of intellectual self-care is to build puzzles or play a game. So engaging in activities like crossword puzzles, Sudoku, or playing chess. These activities challenge the brain and enhance the problem-solving skills. And then lastly, doing creative activities. So for example, engaging in arts and crafts or writing. So by doing creative activities, it stimulates the different parts of the brain and it helps with intellectual growth. And doing these different types of techniques will also help with managing your stress levels and improve your mental clarity. So as Ellie mentioned previously, all of these different types, they influence one another. So it's one of those, you can't focus on just your intellectual self-care and not your physical self-care, because they do influence one another. So it's looking at the different types of this holistic approach that you need to follow to improve your overall well-being. Ellie, before we continue, anything that you would like to add?
Yeah, I think this one is quite a neglected one, especially within, the addiction field where and it's quite an important one where families can actually, gain insight and become more knowledgeable on the topic of addiction. I think it's quite a complex topic, and when you're able to research and to learn more about whether it's substance use disorders, whether it's cross addiction, whatever topic within the realm of addiction, to empower not just your loved ones, but yourself as well. So I think it's quite a neglected area, but we're hoping that as you listen to, this presentation, that you're gaining insight on how you could perhaps develop in this area.
I agree with you. Thank you, Ellie. Okay, and then our next type is spiritual health and spiritual self-care. So spiritual health is just as important as physical, mental, and emotional well-being. And some people argue that it's the most important aspect or type that you need to focus on. So spiritual self-care connects us to our deepest sense of meaning and to our purpose. Maybe you don't consider yourself as a spiritual person, or perhaps you don't have a belief in a higher power, and that's okay. You don't have to be a Zen guru to earn the many rewards that come with spiritual self-care. So examples of spiritual self-care is, once again, meditation. So spending time in a quiet place during reflection or meditating. Another example is through prayer. So engaging in prayer or other spiritual practices that will help you. And then some people use nature. So spending time in nature to feel more connected to the world around you. So that's only examples of spiritual self-care. Anything you would like to add?
No, all good this time.
Great. Okay, and then we come to social self-care. So the social self-care focus on building and maintaining healthy relationships. So with other people. So it involves activities that help you build strong, positive connections and foster a sense of belonging. So having a robust social support system is essential for emotional well-being, and it can provide as a buffer against stress. Okay, so let's explore some examples of social self-care practices. So this can include regular meetups with the people you love spending time with. So for example, scheduling weekly or monthly get-together with close friends or family members. By doing this, it's that consistent face-to-face interactions that help strengthen our bond and provide that emotional support that we all need. Another example is phone calls or video chats. So we are fortunate in today's life, we all have smartphones. So we don't have that as excuse anymore to say, I am so busy, I can't come to you, or I can't see you face to face. We all have smartphones where we can call someone, and yet better video call them so we can actually see them visually. Okay, so example of phone calls and video calls is calling or video chatting with loved ones who live far away. So by regularly checking in with those you care about, even from a distance, helps maintain close relationships and provides mutual support. And then another example is peer support groups. So, for example, attending groups for those experiencing similar issues, such as addiction, grief, or chronic illness, By sharing experiences with others, we understand your situation, can provide some comfort and advice and a sense of community. For example, this group that we're on every Tuesday it's a support group, and we all have something in common, and we all have shared experiences when it comes to addiction and our loved ones. And then another example is community organization. So participating in local clubs or religious groups or community service organizations. By being involved in the community and their activities, it fosters a sense of belonging and connection. However, when it comes to social self-care, and to be honest with you guys, actually all the different types of self-care, it comes with boundaries. So I think that is something that we all struggle with, especially when it comes to the people that we love. We tend to put all our energy into them. Just one example, putting our energy and all our worries into our loved one that's currently in rehab or going through this monster of addiction. It's important to set boundaries and to make time for them, but also make time for the other areas of your life. And setting boundaries doesn't mean you don't love them or you are mad at them. Setting boundaries is there to protect yourself as well. Ellie, anything that you would like to add?
Yeah, I think this is also quite an important aspect because we know that addiction can be quite an isolating experience, whether for the addict or the family. And once this area is neglected, it perpetuates the problem. You know, part of social self-care is understanding that we are social beings. We are connecting beings, and it's important that we don't face any issue in isolation. And I think it's also important that we normalize help-seeking behaviors. There's a lot of stigma around help-seeking behaviors. And I'm hoping that with the generations to come, you know, we can be more receptive towards help-seeking and more open to it, not just when it comes to addiction, but when it comes to the effects as well.
That's true. Thank you for sharing, Ellie. Before we come to different examples that I will give you once again, I have this little acronym that I use when I focus on the different areas of self-care. So I call it PIES. So it's PIESS, and then I'll add the M at the end. So P is your physical health, I is your intellectual health, the E is emotional health, and then the S, spiritual health and social health, and then the M is for mental health. Okay, so it's important to check in with those different areas each and every day. With my experiences and during my training in psychology, I've learned that usually when we feel a little bit down, or we're having fatigue or compassion fatigue or irritability or frustration, it's usually one of those areas that is not fulfilled, that needs a little bit more love. So this is just an easy way for you to remember your different areas that you need to work on when it comes to your own self-care. Okay, then you have to be intentional about your self-care. It's not something that will just happen. It's once again a habit that we need to form. So you have to make it a priority and set time aside to take care of yourself. For instance, if your physical self-care or your emotional self-care rather would be to go lay in a bath with a lot of bubbles and candles, you need to take time apart for that. So every Wednesday night, I'm going to take 20 minutes just for myself. Okay. So even if you have to use a schedule, it doesn't have to be for a long time. It can be 10 minutes. 10 minutes, I'm going to focus on my intellectual health by maybe listening to a podcast or watching a YouTube video. Emotional self-care. For these next 20 or 15 minutes, I'm going to check in with myself and my emotions and maybe write down why I'm feeling these emotions, what happened before that I'm feeling this, maybe what triggered the emotion. Okay, so here are a few examples of how self-care might show up in your life. So taking a hot bath, going for a nature walk, listening to your favorite music, enjoying a cup of coffee or tea with a supportive friend, maybe taking a mini vacation, meditating, prayer, stargazing, setting healthy boundaries, taking a drive, or fellowshipping with other recovering people. So like I mentioned, this is a supportive community where we all share, we all have similarities and share the same experience in a way. Another example is going to counseling, finding hobbies that you enjoy, or reading spiritual lectures. Just remember this is your recovery journey. And you're going to need to find what works for you. So as I mentioned earlier, this is the time where you need to go through trial and error. Maybe I tried meditation and that didn't work for me. Maybe that is something that will work for my friend or my sister or my brother. But rather I need to journal about it, or I need to go for a run, go to the gym to release the stress. So this is your journey. There's no right and wrong. And once again, you need to find what works for you. Okay, so anything you would like to add, Ellie?
Nothing. I think you covered quite a lot.
Okay. Okay, so now we get to for me, this is the exciting part. So let's talk a little bit about the brain's role in our happiness. So we have 4 key neurotransmitters. Okay, so you'll see the acronym that I use is DOSE. So that is your dopamine, your oxytocin, your serotonin, and your endorphins, and how they play a significant role in how you feel. So let's start with dopamine. So dopamine is called the reward neurotransmitter. So it gives us a sense of pleasure and satisfaction. Okay, so eating nice food that you enjoy, setting yourself small goals and achieving those goals. It doesn't have to be big goals. Even if you make a little goal list, and it would be to stand up in the morning at 6 a.m. When I wake up, I make my bed. That's a goal for you to have, okay? Completing a task and other self-care activities. The next one is oxytocin. So this is known as the love hormone. It helps us feel connected and bonded to others. So once again, this is like socializing, the physical touch, petting an animal, and helping others. So just by mentioning these two, I think we can see how the different types and areas of self-care play into each neurotransmitter, so each hormone that we feel. Then we get the serotonin. So this neurotransmitter contributes to our overall mood and our well-being. So that is the mood stabilizer. So sun exposure is an example. Mindfulness, so activities like meditation, being with nature, even just to go sit in the garden, maybe sit in the sun and just focusing on yourself. What do you hear outside? How does the air feel? Is it cold? Is it windy? Is it hot? Um, just taking that moment for reflection. This will help with your serotonin levels. And then the last one is endorphins. So these are our body's natural painkillers and mood alleviators. So often it's released during exercise. Okay, so exercise is an example. Listening to music, even better if you put on your favorite song and you take that 2 minutes and you just dance it out. By doing that, you're releasing these emotions, you're exercising, you're listening to your favorite I almost said painkiller. Well, it is a painkiller to your favorite song. Who won't be happy? Will feel a little bit better after that. It can also be to watch a little bit of a movie and to make a joke here and there, to laugh a little bit. So these are the different types of neurotransmitters that we get. And like I mentioned, there's different activities that we can do that fits into the areas of our self-care. So our physical, emotional, intellectual, social, spiritual, and mental area that we can do to activate these neurotransmitters. Ellie, anything that you would like to include on this?
Yeah, no, I think it's very important that we do engage in self-care. You know, our rehab really focuses on behavior therapy because we understand that our behavior impacts our thoughts impact our emotions, and that cycle, it's a continuous cycle. And some of the suggestions that have been made or the recommendations that have been made may sound quite surface, but the more practice, the more the brain changes. You know, when we speak about the brain, there are schemas that develop, and that the brain actually has the capacity to change structure when we engage in behaviors like self-care. So I think it's quite important that we do engage in those, you know, those self-care activities, because then ultimately we're impacting our brain and we're impacting our health. Yeah, so love this slide.
It's one of my favorites too. Thank you, Ellie. So coming to an end of this workshop, in conclusion, self-care is not a luxury, but it's a necessity, especially for those dealing with addiction, stressing about your loved one and their addiction. By taking care of ourselves physically, intellectually, emotionally, spiritually, socially, and mentally, we build that resilience needed to support our loved ones and maintain our own well-being. So remember, taking time for self-care is an essential part of being able to care for others. So thank you for joining us today and giving me the opportunity to teach you a little bit more about self-care. And please take these insights to your heart as you continue on your journey. So for now, our workshop is coming to an end, and it's now time. If you have any questions, you're more than welcome to ask.
Yes, I'd like to ask a question.
Hmm.
Can you hear me?
Yes, I can hear you.
Yes, we can.
Yes, I'd like to ask about the process of detox. What is involved? Is it medication? What are the side effects? Does it make you drowsy? How long does it take until it kicks in? When is it needed? How do you know it's needed? All those sorts of questions about detox. What is it?
Okay, how do we say your name? Sorry, just don't want to
Siobhan.
mess it up.
Okay, Elliot. Siobhan, it's like Yvonne, but
Okay,
Siobhan.
Siobhan, thank you so much for
Yeah.
your question. So look, detox is the very first process that we start with at our rehab. They are offered a type of medication that flushes their system, as we know that some drugs, well, most drugs enter the bloodstream, and they ultimately impact the body. So detox is the process of trying to extract those toxins and that have entered the bloodstream. And it can be quite a brutal process because remember, some of the addicts have been on their drug of choice for a long time, and it does sometimes cause damage to their bodies or their bloodstream. And the detox normally depends on the drug of choice. Um, I won't say the medication that is used. I think that's something that you can ask the psychiatrist or the counselor because it varies. But yeah, it is a brutal process, and some people experience side effects like vomiting. Other people may feel nauseous. Others require long-term sleep, and by long-term sleep I mean like we have patients who sleep for 3 days because of the impact on the bloodstream, the impact on the body, and the impact on the brain. We've had, patients who experience manic episodes because they have developed dependency on the drug of choice. So it varies according to individuals and according to the severity of the substance use disorder. So there's quite a number of factors involved. I hope you answered. I think we do have our psychiatrist, and Dr. Tia can, elaborate more on this.
Detox depends on what you're on. If you stop alcohol without cover, you might have quite serious seizures and can get brain damage. If you stop a benzodiazepine too quickly, people can have problems walking for up to 3 months afterwards, with problems with managing their muscles. So all of this has got to do with the neurotransmitters that's overactivated by the substances they use, and we have to slowly get them to not be activated. A lot of our detox is just because people feel really bad if we stop the drugs, and we're trying to get them not to go through severe withdrawal, which will often then be so bad and they'll crave so badly that they'll actually leave rehab to go back to a drug because it's so bad. So we're trying to make it easier on the body for people to get off the drugs, and also a little bit easier on the mind. Some detox needs to be over 2 or 3 months. Some detox can be 3 days. Some of the substances don't need detox, but we know we have to manage those cravings because else they're going to leave, because it's severe. People, they really suffer with it. So detox is made person to person on what drug they are. Lots of them get similar drugs or the same drugs if they have similar substance abuse. But the main thing is to protect them medically and to help them with the severe cravings. Does that help? Do you want some more?
Siobhan, are you still there?
How do you know detox has worked?
You need to, there's an actual scale, which we call the SIVA, and the where we look at blood pressure, we look at
SIVA,
pulse.
could you spell that for me, doctor, please?
CIWA. So
SIWA.
No,
Okay.
CIWA.
CI, SIVA, right.
There's different scales. We use one for alcohol, we use one for other drugs. So it depends. We look at the skin, if there is any if there's any pins on it. We look at the temperature, we look at the blood pressure, we look at the pulse, the color of the eyes. So there's objective things that we test to see if withdrawal worked. But a lot of the withdrawal is, they work, but what do? They make it for everybody easier not to go back to drugs. So it's not a question that if withdrawal work or not. It does work. It's what do you want to achieve with it?
Thank you, doctor.
No,
Thank
so
you.
if it's objective how we look at if people need more medication or less medication.
Mhm.
And if they need more, we'll give more. But it's not necessarily because they want more. It's because of objectively their blood pressure and their pulse is not better and they're not sleeping. So it's
So
objective.
you have definite markers to see whether you increase or decrease the detox with lack of sleep or the temperature or skin or whatever you're talking about. Thank you very much, doctor. That's very helpful. Thank you.
Okay.
Thanks for your question, Siobhan. Any other questions from the floor?
Hi, yes. May I ask a question?
Just spell your name for us. Is it Tara?
It's Tara, yes, Tara.
All right. Hi, Tara.
Hi, yes. I imagine a lot of your patients are dealing with liver damage in whatever form that comes in. What is your protocol for treating liver damage, no matter where it sits on the spectrum?
The best one for that is NAC, N-acetylcysteine. It is the drug that is most often used in any of the liver damages, specifically a paracetamol overdose and a couple of others. So the others are things like milk thistle, etc., has not been really proven to work. I don't mind if patients comes in for them to stay on it, but all the patients go on N-acetylcysteine because that's the major treatment for it.
Oh, excellent. And then you guys monitor whether that treatment is working and if it's going in the right direction.
The thing with liver is that you can't monitor it every day or every week. It's over a month later you can monitor if it's better or not. And by that time, a lot of our patients is discharged. You can also actually monitor it by the nausea scale and a couple of others. So we don't often do the follow-up blood test, but all our patients get NAC.
Okay, great.
The
Thank you
follow-up
very
blood
much.
test is done as an outpatient because, coming in, those tests are a certain level and they don't get better quickly. So you can actually only see a month later, but all our patients get NAC. It's a non-negotiable from me.
Great. Thank you very much.
Thanks for your question, Tara.
Of interest, we also use thiamine for people with alcohol so that we can immediately replace the vitamin B1 that alcohol takes out of the brain. So those two, the thiamine if you've used alcohol and NAC, is the two things that patients get. It's non-negotiable. The bad thing is that neither one of those two are paid for by the medical aid. But both of them are available as health supplements in health stores and on Takealot. And I think patients should be on them long term. Patients are informed about it, but I'm so glad you're asking because now I can tell the family because patients forget what I tell them. And even though it's on their scripts, they said, oh, well, we don't need it. They need thiamine 6 months for every year that they've been drinking. So for some of our patients, that's the rest of their life. And they need super high dosages. Some people give much lower dosages, but for a real response, you need the super high dosages. It's not dangerous if you give a high dose. And the NAC is also super high dosages. So the research with the NAC is that you have to give between 2 and 3 grams. That is the equivalent of 4 of the new ACC 800s. So it's cheaper to buy it from the health stores. It's an easy molecule, so they can't mess it up. So ACC 200 is NAC. And then the other thing that they have is the thiamine is 200 twice a day. And that's also a super high dose. But I've seen through the years, if you give less, the people don't recover as much of their brain function as if you give high. And again, it's not dangerous to give the high dose, but it's dangerous not to give it.
Thanks, Dr. Tia. Let's just see. Cheryl, you wanted to chip? See, you're unmuted.
also wanted to let everybody know that next week, Tuesday, Dr. Tia and I are going to be doing the presentation. So please feel free to gather some questions during the week, write them down so that they can all be asked. Dr. Tia will do a presentation, but then we will open it to questions. And she very happily answers all the questions that you have.
All right, thanks, Cheryl. Chantal is asking, sorry, what was the dosage for NAC?
Dr. Tia, you're muted.
It's 2 to 3 grams. So that's the equivalent if you take the 500 milligram or the 600 milligram tablets that's available in the house stores, of 4 of them. You can split them or you can take them all at the same time. The only thing is that if you don't take it with food, you might get, you know, when you take vitamin C, you get that acidity thing, and that might happen with the NAC if you don't take it with food. But I actually give my family NAC as birthday gifts and Christmas gifts. So there's a couple of other things that it works for too, including anxiety.
Thanks, Dr. Tia. Any other questions? We do have room for 2 more questions before we close.
May I ask another one?
Sure.
Can liver damage be reversed, Dr. Tia?
A lot of the liver damage actually can be reversed. Some of them have damage, but there is a recovery of some of it. So not everything can be reversed, but a lot of it can.
Thank you.
If you reach a certain stage, then it can't be reversed. But I've seen very few of our patients really having reached that stage. Most of them, we can get them a lot better.
Thank you, Dr. Tia.
Also, we need to think about kidney damage. Kidney damage also happens with the substances. Kidneys is way less forgiving than liver. You can actually improve the liver. Often you can't improve the kidneys. The main thing with kidneys is just to keep on taking in as much fluid as you can. And if it's all of our patients' kidneys are not where it should be, but it's not to a level where they need to see a renal physician. However, we always have to watch, because that's the one thing that don't recover well. So patients cannot be dehydrated. They have to drink enough. There isn't much else we can do to fix that, but that's a bigger problem for me than the liver. Because liver is quite, liver is forgiving, kidneys are not. And kidneys are often with the stimulants, so with cocaine and meth, and it's just not as forgiving as liver.
Thanks, Dr. Tia. Any other questions before I close? All right, if there's no other questions, as Cheryl suggested, feel free to bring questions to the next family support. We're more than happy to answer them. All right. We have run out of time for today. Changes Rehab thanks you for joining us at this meeting, and we encourage that you keep coming back. The opinions expressed here were strictly those of the person who shared them. Take what you liked and leave the rest. Our meetings may be confusing, but in time, you will begin to understand that recovery is a process, and nothing we do or say can bypass that. You may not like us or what we have had to say, but you may grow to love us the same way we can love you. in our families. But since it's here, and even though we avoid blame, we endeavor to accept that we may have become part of the problem, and it's our personal choice if we are to become part of the solution. Thanks to all who shared, and thanks to all who listened. Please keep coming back. It works if you work it. Tough times don't last. Tough people do. Changes Rehab, thank you for joining us, and we look forward to seeing you next Tuesday at 6 p.m. South African time. Please continue to join us every week, same time, same login, for as long as you need us. Please join our Facebook, Instagram, and Twitter pages to receive ongoing recovery messages. Please kindly lift your mute button so that we can all join in for the closing prayer. Who loves us? God. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and with the wisdom to know the difference. Thank you, everybody.
Bye-bye, everyone.